afternoon. How are you, sir? Good. Good afternoon, everyone. I want to acknowledge our Public Health Commissioner, Dr. Allison Harwoody, who's with us here today, along with our Commissioner of Business Affairs and Consumer Protection, Rosa Escareno. Earlier this week, we shared some of the very troubling COVID-19 data that we've seen in recent weeks. In announcing that data, I said that if we don't see a dramatic turnaround, and soon, then we would not hesitate to take the steps necessary to keep our residents safe and healthy. At that point, just a few days ago, our average daily rates of new cases had reached 500, marking a more than 50% increase since the beginning of this month, and the highest daily rate that we've seen since the tail end of the pandemic's first wave back in May. It also coincided with a worrying increase in hospitalizations. Since we made that announcement just 4 days ago, our city's daily COVID case rate has now surged and reached over 640 cases on average a day. We are, no doubt whatsoever, in the second surge. This is what it looks like. And due to this latest increase in numbers, I, in consultation, of course, with our public health experts like Dr. Harwoody, will be putting in place a business curfew for the city of Chicago over the next 2 weeks in hopes of stemming the spread of this disease. Now, we've reached out to business and community leaders in advance of today's announcement, and we will lean into further engagement with these groups who have been invaluable partners and, as you know, have been severely impacted by COVID-19. A business curfew means the following. Effective tomorrow, all non-essential businesses will be closed to the public from 10 p.m. to 6 a.m. All liquor sales will be closed as of 9 p.m. across the city. That's restaurants, cocktails to go, and any other alcohol sales stop at 9 p.m. And as with the first surge, exceptions will be made for our essential businesses, like grocery stores, pharmacies, and restaurant delivery and takeout services. Meanwhile, bars that don't operate with a food license will no longer be permitted to serve customers inside. And finally, I want to make a special point on this. We are asking all Chicagoans to refrain from gatherings of more than 6 people, as well as social gatherings of any sort after 10 p.m. And we are taking these measures to avoid potential catastrophic impacts later. As we're all aware from the daily headlines, the rapid rise in cases that we're experiencing here in Chicago is consistent with what we're seeing not only across the state, but across the nation and in many other countries around the world. This is what public health experts and responsible leaders have unfortunately been forecasting for months. And the reason is simple. COVID-19 thrives in places and in circumstances where people let their guard down. And as the weather cools and people move indoors, the risk of the spread rises exponentially. That's why we have been preaching about limiting the size of gatherings, about wearing a mask everywhere you can, and particularly outside when you're socializing, you're coming into contact with other people. However, compounding all of this is reports that we're now seeing uptick again of large groups of people gathering without social distancing and worse, without masks. Now, some of it, of course, is a misplaced sense that that those you know don't have it. That's wrong. Some of it is COVID fatigue, which we get. But some of it is just simply being irresponsible. Whatever the case, the fact remains we have to wear masks. We have to social distance. We have to engage in hand washing and all the other socially responsible public health guidelines that we have been talking about since March. We have to remain vigilant. COVID-19 has not gone away. It has not disappeared. We're not out of this crisis and this pandemic. It is very much part of our present. Now, I know that you all have made a tremendous number of sacrifices, really going back to the spring. Everyone's world has been upended. And it's tough to think about some uncertain future where we have to remain as diligent and making the kind of sacrifices that we've made all along. But I'm here to tell you, there's no other option. It doesn't exist. If it did, we would be talking about it. We would be promoting it. It doesn't exist. We all have to use the tools that are available to us now and take advantage of the opportunity for ourselves, for our families, our friends, people in our network, but also our neighbors across this city. Let me also just say that we as a city workforce need to be better ourselves in mask wearing. This includes our public-facing departments and agencies like police and fire, as well as streets and sanitation. And we are asking our commissioners in those departments, but truly in every city department, to build updated strategies to ensure that your workers get the message. They must wear masks. And if they don't get the message, you need to take decisive action, up to and including discipline. I've asked the inspectors of the Chicago Police Department to start ensuring folks in every unit across the city wear masks. And where they fail, the time for educating people into compliance is simply over. If you're an officer, you're a fireman, paramedic, if you're a city employee, I'm telling you now, as your mayor, as your boss, you must wear a mask, period. Throughout this crisis, we have worked to be prudent in reopening our city. We worked to use a dimmer switch and not a light switch. And for much of the summer through August, we did well. We didn't see the surge that many had predicted. But we had a problem in August. We jumped on top of it, and we were able to see case counts go down in September. But now we're at another inflection point and another challenge. And we have to be just as diligent now as we have been all along. We have to dig down deeper. This is a critical moment for us, and it's really going to determine what we all are experiencing for months to come. I cannot understate and underscore that enough. What we do now will make the difference between what our future looks like and what it could be. Whether or not we are a city that is, again, a model for the nation, or whether or not we're going to be another data point on the spread of COVID-19 that seems to be spiraling out of control. Each of us have the power in our own hands to write our own destiny, our own narrative, but it has to start now with getting back to basics. Wearing a mask, social distancing, limiting crowd size, and not allowing non-family members, people who are not in your bubble, into your homes. This virus is relentless. It doesn't respect our boundaries. It's not something that we can keep at bay when we're in our home. It isn't. We've got to be diligent every single day. And again, it starts with the actions that you take, that each of us take individually, to help our city get beyond this terrible surge in cases. Dr. Artie will provide more details in a moment, but the rising case numbers we're seeing are happening across the board, across every zip code, every demographic, every age group. The curve is going up again. If we pretend to know that COVID-19 isn't the deadly virus that it is, the result will be more sickness and more death. And Dr. Artie will detail this in a moment, but we are starting to see that uptick in hospitalizations that we're all concerned about. That's a lagging indicator. But what it means fundamentally is if people are getting sick enough to go in the hospital, they're going to move from the hospital into the ICU, and from the ICU onto ventilators. And what that means is that there are going to be a certain percentage of those folks who die. Our death rate has gone down significantly from what it was. We do not want to see more people lose their lives to COVID-19. And while I'm up here, I also want to say again a message to our young people. You've heard me say it before, but I'm going to say it again. You are simply not immune from COVID-19. You can and you are getting it. And your numbers of infections are going up again. 18 to 29, 30 to 39. Your rate of increase is alarming, and you need to take heed, and you need to wear a mask. You need to be better equipped to overcome the surge, but you are still spreading it to those who aren't. And this has to be an all hands on deck moment for all of us, but especially for you, young people. What none of us want is even further restrictions as we move into the holiday season, impacting Thanksgiving, Hanukkah, and Christmas traditions. But that is exactly the path that we are on right now if we do not take heed and adhere to the tools that got us to a better place in the first place. Now, I've said this before, we're taking these steps now. They'll go into effect tomorrow. But if we need to take further steps and move back into phase 3, or even going back to shelter in place, I'm not going to hesitate to do that. I hope that won't be necessary, but it's all in your hands. It's all in your hands. To keep all that from happening, we need to also be limiting the number of people we come into contact with on a daily basis. The more people gather, the chance this disease spread increases exponentially. And I know that's easier said than done for many, our essential workers, and particularly those in our Latinx and Black communities. And we will continue to be reaching out and supporting you in every way that we can. We understand how disproportionately you have been affected by this terrible, terrible disease. But I want to emphasize the one thing that each of us can control is who we come into contact with, who comes into our home, how many times that we're out in public. That has got to be something that we think more seriously about as we see this second case surge happening. I don't want to put more restrictions in our city. No one does. But I have to do what's right to save lives. And if that means rolling back further, I will. My friends, we have to be in this fight together, because together is the only way forward and through. Together means that we are working hard as individuals, as family members, as neighbors, together to really fight this virus with the tools that we have at our disposal. Wear a mask. It's that simple. It's not a political statement one way or the other. It's a public health statement. It's about saving your life and saving the lives of people that you come into contact with. I urge you, I beg you, to take this case surge seriously. It is frightening. The rapidity with which these numbers are doubling on a day-by-day basis, that the increase is startling. It's really quite breathtaking. If you think about where we were just 2 weeks ago, or even at the beginning of October, and where we are now, it's like we're back in the spring. So folks, we've got to do what we know that what works. Social distancing, wearing a mask, washing your hands, and limiting your contact with others. Dr. Arity, please provide us with some additional insights.
Thank you, Mayor. So as you heard, the average number of diagnosed new cases in Chicago stands at 645 new cases per day. But that's a 7-day rolling average, and we've already had multiple days with 800 or even 900 cases coming in, and the numbers are still going up. Just 1 week ago, we were at 418 cases per day, an increase of 54% in just 1 week. We've had a total now of 90,722 people diagnosed with COVID in Chicago, meaning they were tested. Let's break that 90,000 down. 7,055, we estimate, are active right now, meaning they are infectious and they have been tested. More than 80,000 people have recovered, and more than 3,000 people have died. But let's focus on that active now number. We've got 7,000 people right now who have been diagnosed and are in their period where they would be infectious. But we know across the US, between 5 and 10 times this number of people have actually gotten COVID. Everybody is not being tested. Our testing rates are quite good here, so where we look at our testing numbers, our death numbers, our serology numbers, our estimate here is that it's in the 5 to 7 times range, which means right now, between 35,000 and 50,000 Chicagoans have active, meaning infectious COVID, right now. This is what that looks like. We only catch the tip of the iceberg. And I do want to remind everybody that if you are having symptoms or you have had a known COVID exposure, you must get tested. If you are living in a setting where we're seeing a lot of spread, we need you to get tested. But we know that not everybody is. And this is, again, as we mentioned on Monday, why large gatherings and even small gatherings are posing significant health risks right now. There is a 30% chance that someone in a group of 25 people has COVID-19. There is a 50% chance that someone in a group of 50 has COVID-19. Even getting together 10 people in Chicago, 14% chance that someone has COVID-19. Let's talk about our reopening metrics. So we set these out as we moved between phase 2, 3, and 4 for how we would follow our progress here in Chicago. And first, as a reminder, we followed cases, hospitalizations, deaths, and emergency department visits. And just a week and a half, 2 weeks ago, we were in green here. Everything was looking good. When we were up here on Monday, we were in yellow, meaning that we'd seen an increase between 1 and 14 days. But we are now solidly in red, which means it's time to pull back. Similarly, just a week ago, we were well under 5% positivity. When we were up here on Monday, we were just getting over that 5%, getting into the 6% range. Well, we're getting close to 8%. And then finally, the ICU numbers, the ICU numbers and the non-ICU numbers are increasing. So let's talk details there. Cases, look at that. We showed this rate of increase on Monday. We've seen no flattening of that curve since then. And in fact, the cases now in Chicago are growing at the same rate that they did at the worst of the first wave between March 19 and 31 and April 15 and 29. Testing is different. The demographics are different. That doesn't matter. The rate of increase is what we are concerned about because it is reflective of whatever your recent testing patterns have been. Also a severe warning, similar to Monday, but only getting worse, COVID-19 cases dramatically increasing across all race ethnicity groups. Similarly severe warning, continuing to dramatically increase across all age groups, importantly, including among older Chicagoans. Down at the bottom of this graph, and I encourage you to go to chi.gov/COVID- if you want to see the details. The pink and gray at the bottom there are our people over 70 and our people over 80. Those are going up. They're actually higher now than the rates in our 0 to 17-year-olds for the first time in months. We know older people more likely to have severe outcomes. We know younger people spread COVID to older folks. Major concern, and particularly where we are disproportionately still seeing cases among 18 to 29-year-olds, followed by 30 to 39-year-olds. We've looked at the data to see where do people go in public from those age groups. And a severe warning, our test positivity is increasing. You see on the graph here how quickly it shot up. 1 week ago, we were at 4.6%. Today, we're at 6.4% related to what has come into CDPH, but we're at 7% per the state numbers, because there can be some delay in terms of when numbers are coming in and whether we're counting the dates by when someone is diagnosed versus the dates that it's reporting. That 7% number is important, because if you've been paying attention to what's going on around Illinois, when we hit 8% positivity, even further rollbacks come. Indoor restaurants close. Gatherings are limited to 25 people, 25% capacity. There's additional details. And when I'm looking at 6.4% positivity in our numbers today and already seeing that 7% is on the horizon, I know that we are increasing. 7% is the best that any region is doing in Illinois, and it is not good. And also a severe warning. I still heard people thinking that the testing was what was driving a lot of this change. And I'll just remind you, in blue here are our tests per day over the past few months, and you can see that it's continued to increase. But that purple line is our number needed to test to find one case. Those should track along with each other. But higher is better. If it's taking us 20 people, 30 people, 50 people to test to find one case, that means COVID's in good control. Where that purple line is dropping, and now we're at just 16 tests to find one positive result, we're not keeping up from a testing perspective with the outbreak that we're seeing in cases. And then COVID hospitalizations. 1 month ago from today, September 22nd, was our low point for people in the hospital here in Chicago with COVID or suspected COVID awaiting a test result. We got down to 249 people, and that was just under our 250 mark to be in that most advanced stage from hospital capacity. But on Monday, when I stood up here, we were at 314 average cases. And just 4 days later, our average is up to 360 cases in the hospital, and our most recent day is at 460. We are hearing across Chicago, we're hearing from our hospitals that they're standing their COVID teams back up again. We're hearing from all settings, including workplaces, that they're seeing more people with COVID coming in. That's because there's so much more COVID here in Chicago. And when we see hospitalizations on the rise and non-ICU hospitalizations also just starting to increase, we know there's more to come. People probably saw that across Illinois, we broke the record, unfortunately, for deaths again in this second surge yesterday. We've not yet seen that in Chicago, but I fully expect that we will see it, particularly if we can't turn this around. So I also mentioned on Monday, and this remains true, that 2 out of 3 people diagnosed with COVID-19 know the people who likely infected them, and 3 out of 4 of those close interactions take place at home. We got some questions afterwards. How is COVID getting into the home? Because COVID does not arise newly in homes. People are out being infected in community and then bringing it home to where you feel safe, to where you're not wearing your mask, you're not social distancing. So it stands still. I do not want you having anybody into your home who is not essential for being there. They live there, or they're providing essential service like home health care, education, or childcare. And if you have people in, please, masks are crucial. But where we look at the risks of where people are being infected, this isn't a secret. We know, unfortunately, that bars are a significant risk factor for spread. We've seen that locally, we've seen that nationally, and we've seen that internationally, especially where we're seeing disproportionate cases among younger Chicagoans. I do just want to make a couple of quick examples on that so you know we're coming from a place of data here. We've been investigating since bars, remember, were able to reopen October 1st at 25% capacity. We're investigating a networking event at a bar that had almost 150 people in attendance. Yes, they were spread out into tables of 6, but they were switching tables frequently to socialize among all of their friends. Yes, masks were required to be worn, but people take their masks down when they're drinking. And when we talked to people, there was not all the consistent mask wearing that we'd like to see. There was just one attendee who was found to be infectious without symptoms. We've already had 5 additional cases identified to date, and we're still following up. And when we talked, we did a case control where we talked to people at this event who were infected versus people who were not infected, at least not yet, haven't had symptoms yet, or had a test yet. And actually 0% of the people who were cases said, I was wearing a mask all or nearly all of the time. Only 40% of those who we interviewed that were uninfected said, yeah, actually I was wearing a mask all or nearly all of the time. It's hard when you're drinking, it's hard when you're eating, I understand it. But we need folks, especially in those restaurant settings, to keep those masks on whenever you're not eating. We also heard that the cases were less likely to report social distancing. 25% said they were really distancing all or nearly all of the time, and almost twice that many among those who were uninfected. We've got a second October birthday event at a bar where we've already seen spread and is under investigation, and earlier clusters from this summer. No huge outbreaks with hundreds of cases, but clusters of 2 and 3 and more than 5 people. Nothing against the bars, but it is a source of spread. And internationally, we have seen major examples of spread at bars. This was an example that's been published in the literature and led to major shutdowns in Hong Kong of bars. This was a single bar event that had 106 cases linked to it. 73 infected at the bar, 39 in customers, 20 in staff, 14 in the band that was playing there. They eventually were able, they think, to trace it back to one employee who was not symptomatic at the time. And then what you see in this pattern, an additional 33 secondary and further cases from there. The blue representing family members for people who were at that bar, the red representing work colleagues. So as we're thinking about what comes next here, I hope you are hearing that we need you to do everything in your power to stop giving COVID the chance to spread. You know what to do. We need you to do it. We'll continue to give you updates. We'll continue to use the data. If we can turn this around, as soon as our numbers are looking better, we'll be the first ones up here looking to reopen things. But right now, that's not the way things are heading. So please, be safe, Chicago. And I'll invite Rose Escarino up.
Thank you, Dr. Arwoody. So good afternoon. My name is Rosa Escarino, Commissioner for the Department of Business Affairs. And, you know, you can't follow that presentation. We're obviously in a very serious situation. And so while my heart goes out to the thousands of business owners and their employees who have made unbelievable sacrifices, and they have stayed the course with us, following guidelines and regulations. But this is not, we're not tunnel vision here in Chicago. This is a community effort. We must all come together and we must work together to ensure that the lives of all our residents are the priority for us. And we know that as business owners, you do not have a customer if the residents do not feel safe. So again, we must put the health of our residents first. And as the second surge is here, the data obviously is alarming, and the time to take action is now. So both the mayor and Dr. Arwoody have laid out not only the guidelines and the requirements for our business community, but also the reason behind why we must take these unprecedented steps. Again, we must come together, work together, over this next few days to prove that we can continue to bring down those case numbers that are dramatically increasing. And so again, I want to thank the business community for working with us. We have been extremely aggressive on our enforcement, conducting over 3,000 investigations just this summer and through now. We have closed over 60 businesses. We're talking business closures. So we're not taking this lightly. And with these new regulations, we will be communicating to the business community starting tomorrow. We're holding workshops to ensure that while some of the guidelines have been presented to you today, this actually impacts all businesses, and we will make sure, please follow us, and we will make sure to get that information to you. But the time to act is now. Information is going to be coming to you as early as tomorrow, and these guidelines go into effect almost immediately. We realize that you have a short time frame to operationalize these changes, but you've done it before. We will be working with you to ensure that we're allowing you time to implement. However, I want you to know that we are not shy about taking enforcement. And as Dr. Arwoody stated, these spreads where we've seen where we've actually stepped in and closed businesses, we are seeing illegal operation of congregation of groups, whether it's in a commercial setting or in a home. Our task force has been set up to make sure that we're addressing those very groups. It is that kind of behavior that has gotten us to this point. But we know how to actually do better. We've done better. We've been there before. So let's work together to do that. I also want to remind the business community that from the very beginning, the mayor and the entire administration has been extremely supportive of our business community, setting up $150 million in loans, grants for our business community. And I want to remind the business community to make sure that you apply for the state business interruption grants that are still available to you. There's also other the grants that are out there for our venues that are being stood up by our Department of DCASE that we're also helping to make sure that you get that information, that you apply for all those resources. So again, I want to just remind you that as the regulator of licensing here in Chicago, we are going to work with you. We know that we can do this together, but importantly, we cannot. We have to do the right thing, and we will be out there to enforce. I just want to take a moment to repeat this very important message in Spanish, specifically because many of our businesses are Spanish speakers, and certainly the Latinx community is being impacted. So buenas tardes. De acuerdo a los datos del Departamento de Salud y la doctora Arwoody, los casos de COVID continúan aumentando. Es un momento crítico en este punto que estamos con COVID. Y desafortunadamente la comunidad hispana tiene más casos que otros grupos. La salud de nuestra comunidad tiene que ser la prioridad. Quiero dar las gracias a todos los empresarios de Chicago que han sacrificado muchísimo durante esta pandemia. Hoy anunciamos nuevos reglamentos. La alcalde ha detallado eso. Y a partir de mañana, todos los negocios estarán cerrados de las 10 de la noche a las 6 de la mañana. Y las horas de licor deben de terminar a las 9 de la noche para todas las industrias. No hay excepciones. Y se harán también las únicas excepciones van a ser para los empresarios o los negocios esenciales. Esos son las tiendas de abarrotes o los supermercados, las farmacias, y también los restaurantes van a poder entregar comida para entrega o para llevar, pero también los restaurantes deben de cerrar sus puertas a las 10 de la noche. Mientras tanto, las tabernas que no tienen licencia para servir comida, o solo las tabernas de licor solamente van a cerrar sus puertas en el interior. Pueden operar afuera, pero no adentro. Y bailes y congregaciones nunca han sido permitidos, y vamos a estar seguros que estamos afuera viendo y vigilando esos locales, porque eso ahorita en estos momentos no se permite. Y finalmente, les pedimos a todas las personas en sus hogares que se abstengan de reunirse afuera de su familia o afuera del grupo esencial de sus amistades. Si van a tener personas en su hogar, las personas les recomendamos usen la máscara. Los casos, especialmente en la comunidad hispana, están aumentando dramáticamente. Esta es la única forma que podemos regresar un poco a la normalidad. Y si tienen cualquier queja, por favor llamen al 311 y reporten sus quejas. Muchas gracias.
Happy to take your questions.
Good afternoon, Mayor.
afternoon.
I know just 3 days ago you made a point of saying that the places that you regulate, bars, restaurants, schools, are not the places where the transmission is occurring. I know the numbers have gone up in the last 3 days, but why a change in this?
Well-
If you made a big point on Monday of saying this is not where transmission is occurring.
I think the question that was asked is, are we seeing specific instances in those areas? And we were not. I think what I said then, and was true today, we're seeing cases primarily in social gatherings, not specific to restaurants. But what we also know, and again, I'm not going to play public health expert up here, I'll let Dr. Arty do that, is that limiting the occasions for gathering, and particularly in areas where the risk is greatest, and that's bars, because people gather, they take their mask off, they have a drink, they socialize, they talk, and it's very difficult to regulate mask wearing in bars, and that's why we're taking the steps that we're taking. But you also heard us say Monday and again today that we're also seeing people catching the virus in other kinds of social settings, particularly in homes. Because we're seeing gatherings happening there. People feel like they're safe in their home. They're letting their guard down. So we just want to make sure that we're doing what is necessary to keep people safe. And we're taking these steps that we think will make a difference. But if we don't see some fairly dramatic change and soon, we're going to have to take some other steps.
This is probably a question for Dr. Arwady, but it's a couple of questions on contact tracing that have come in. The first one from Brett Chase at the Sun-Times. Does Chicago's contact tracing show for bars and restaurant COVID transmission as a percentage of cases? I know DuPage County, they say their contact tracing only shows 6% of transmission at bars and restaurants. What does Chicago show?
So what I can say about that is, so first and foremost, we do not always know causation when we're doing case investigation and contact tracing. What we do when we have a case is we ask, where have you been? Who have you been in contact with? And it is common for people to have been in many spaces and to have contact with a lot of individuals. There certainly are examples, like actually that birthday party at this bar that I mentioned, that was an example of a woman who literally had had one exposure to anybody outside the home in her time, in the time where she would have acquired COVID, and it was at a bar. And so in that case, we can say that is almost certainly where she acquired it. But the great majority of the time, we are not as easily on an individual case level to assign where one may be. We ask people, do they know someone who had COVID? And if they know someone who had COVID, what was the setting in which they were interacting with them? And so that is where, again, this data comes that, again, people mostly spread COVID to other people who they know. And so like in the first bar example that I gave, those were people who were known to have interactions in that space, but then in many cases, these are people having interactions at home. We have asked the questions for everybody who's been a case, which of these public settings have you been in? So we look at, what percentage of people are in bars, what percentage of people are in restaurants, are in barber shops, are in gyms, et cetera. And not surprisingly, we see our bars and restaurants, particularly among our 18 to 29 and our 30 to 39-year-olds, being the main public spaces where they are spending time. And so I wish I could give you as precise an answer to that, but when we have a widespread community outbreak like we have, it is actually very difficult to always know for sure exactly where someone has gotten COVID. Examples like Hong Kong are important because they were not having a widespread outbreak. And so in fact, you're able earlier in an outbreak or very very near the end of an outbreak to better exactly determine the location or the exact exposure that someone has gotten it. So where we see smoke, there's usually fire, and we can often do an outbreak investigation starting from a place. So we'll look, for example, at that bar. We said, who was in this gathering? Let's reach out. Let's do an investigation. We can understand that spread. But the other way, we're really doing an association.
Very similar question from Mark Conkle. He says, asking you specifically to explain what the contact tracing shows about the difference between the risk at indoor dining at restaurants and bars that don't serve food. How much more dangerous are bars than restaurants in Chicago based on the city's contact tracing?
Yeah, so there's a few things related to sort of bars versus restaurants. In both cases, we know people are removing masks. We know, based on some of the stories that I was sharing, that bars do tend to be gathering spaces. People tell us that they're less likely to be out perhaps just with their family. They're more likely to be meeting with friends. They're more likely to be having more interactions, like in the example that I shared, that perhaps you're not just at that 1 6-person table with your family members. The other thing is that, and there's been a lot of discussion about this, not just here in Chicago, but sort of across the country and the world. There's a pretty strong theory that bars are also some of the loudest spaces that people spend time in. And we know, just as locations where people are shouting or singing or exercising without a mask tend to lead to even more spread. We think that the naturally sort of fun, loud environment of bars is one of the reasons why we've seen them be an even higher risk factor than restaurants. And then finally, although we've worked hard certainly here, and again, reference the bars that have been working very hard to try to stick with the regulations, we know there just tends to be more movement. There is a requirement that people be seated in a bar at this time, but traditionally people will be up and moving, and it tends to be less of a staid, seated environment than we typically see in restaurants. So those are some of the reasons. And again, we're really talking to individuals every day about the exposures that they've had, using sort of correlation there, and then diving in on outbreaks where we have actual clusters.
You say these restrictions are for 14 days, so what kind of metrics are you going to use to open back up?
Yeah, so if we go right back to the same metrics we've been using all along, what brings us back into the yellow zone is if we can move, well, the green zone, which would really be moving back, being able to reopen again, is when we're able to see a stable or decrease in these numbers between 1 and 13 days and no increase in the most recent 14 days. So it literally is like when you can flatten this curve, it doesn't even have to be on the way down, but it needs to be stable for a 14-day period. We would be in the space to be able to reverse that. Similarly, green would mean pushing us back under a 5% positivity. That's where we feel comfortable. Where we're in this 5 to 8%, we're in the yellow range, right? Obviously, if we get above 8%, there are required restrictions even at the state level. But these are the things. If we can see stable or decreasing numbers, we can get back under 5%. Our hospital numbers also need to stay in the range that we've laid out. At this point, they are. But that's the other thing that could happen. We could start to see hospital capacity moving into a stage where we wouldn't be able to. So we'll be using those same metrics. It's all about being able to turn this around. And as soon as we can turn it around, using those exact metrics, we would do it. At the state level, just for comparison, again, there's a lot of focus on positivity there. An 8% positivity for 3 days is what makes larger restrictions come in, and being able to get that back under a 6.5% positivity for 3 days is what allow them to loosen. So we look at those, we talk to the state all the time, how do they fit together? But the bottom line is you need to be on the decline here to feel confident about reopening.
Now, on Monday, you said you weren't going to wait to the state standard, which is 8% positivity. So exactly what is the metric that you would roll back to phase 3?
So specifically on Monday, what I was referencing was that we were actually still in the yellow zone in terms of seeing that increase to 1 to 14 days. So the major difference in terms of the Chicago making decision, again, using our metrics, is that we have moved in the way that we count cases into that sustained increase, which puts us into stop. I think where, we've been in close conversation with the state, as you heard, we do have the lowest positivity still of any region in the state, but a 7% positivity is nothing to brag about. about. And we did not feel that it was appropriate to wait when we are seeing numbers increasing the way that they are increasing. So we're putting these restrictions in. Again, I'm hoping we don't need to, put those further things in. But if we continue to see those increases, absolutely we would do that.
Sarah, let's do 2 more.
2 more. All right, I've got some more questions here, but this is from one of my colleagues at ABC7. Mayor, how do you square having some schools being open with in-person learning and then telling people that you can't gather in groups larger than 6 people?
Well, again, let's be precise about what CPS has said, which is we're looking to possibly bring back pre-K and our diverse learners. That decision will be made finally in November. And so what they've embarked upon is kind of a reinvigoration of outreach with parents, with students, and other stakeholders in the school environment. But first and foremost is about keeping everyone safe, and particularly our young people and our vulnerable students in particular. So where that decision leads itself is unknown at this point. We'd love to get people back, those kids back in school. Why? Because it's a simple matter of equity. Remote learning works for some. It's not working for them. And I think Dr. Jackson and Dr. McDade have been very emphatic about this. But obviously, whatever we do is going to be due with our first important priority, which is keeping our young people safe, but making sure that they also have the ability to learn in the school year. And we're concerned about what we've seen so far. So equity tells us that we've got to start on a path of looking at this question and determining when, not if, but when we can get those 2 groups of students back in school.
And this is a question from A.D. Quinn. New York City announced at the end of September it would start imposing fines of up to $1,000 for people who refuse to wear masks. Does the city have the power to do that, and are you considering that?
I always think the best approach is educating people into compliance. I don't want to be locking people up because they're not wearing masks, but they should wear masks. And we've got to create a culture where mask wearing is something that we understand is absolutely necessary to keep ourselves safe. And so we want to make sure that you don't go into a store without wearing a mask. And you're seeing signage on the front of stores, front of City Hall, front of other places where we gather. Restaurants are mandatory. You can't enter, you can't sit down and get a table without having a mask. So we just got to do a better job of really insisting that people wear masks, but we're not going to criminalize mask wearing behavior. That doesn't make any sense to me. Let's spend the resources and energy on education and explaining the importance of math to our shared future as a city.
And just so that, and the last one is an off-topic question from Bill Cameron from WLS Radio. What's the rationale for adding an annual cost of living escalator on the property tax levy?
Well, it brings us into really, I think, a number of different governmental entities, whether it's city colleges, whether it's CPS. And what we've seen historically is because of politics, no property tax. Look, and everybody hates property taxes. I get it. But when you go from a total drought and nothing for years, and then you have this huge historic spike, we want to add stability into the system. We want to add predictability into the system. We hear that from homeowners. We hear it from businesses. They just want to know what the rules are, and so they can account for that in building out other plans, whether it's a household plan or whether it's a commercial plan. That's why we think this modest increase makes sense. And overall, the $93.9 million that we're seeking in property tax increases for the average homeowner with a home value of $250,000, that's a $56. That's right, $56 increase per year. So in this historic year, where we've seen a massive shutdown and meltdown of our economy, when we have a $1.2 billion budget deficit for next year, we've used every other lever that we possibly could, because as I've been very clear, property taxes has got to be the last resort. But let's be smart about it and make it modest, and that's what we've attempted to do. Thank you.
All right, thank you.